Matt Gibson. I'm a vascular access clinician and educator that has worked with patients with vascular access devices for almost 30 years. I've worked in local, regional, and national organizations to promote better vascular access practices and eliminate complications. But we're a long way from eliminating complications. Following aseptic non-touch technique is now the cornerstone for reducing infection risk during vascular access. It's been integrated into the infusion standards of practice, and the essence of this framework is that it protects key parts and key sites. It's a very simple concept, and by protecting those sites, we're going to reduce contamination to the insertion site and ultimately the risk of infection. As we use ultrasound more and more, there's growing reports of the infections that are traced back to this ultrasound gel that we use and the contamination of the ultrasound gel. We're going to be doing a CVC insertion with the Civco Envision cover. This completely eliminates the need for both gel at the insertion site and inside the cover. And really, it makes for quick work post-procedure cleaning up because you don't have a bunch of that mess there to clean up. When you use the Envision cover, it's very similar to the regular probe covers that we're using now. What you're going to do when you use this cover, you're going to pop up the liner tabs, and that's going to expose the silicone adhesive underneath. This is a very gentle adhesive and will eliminate any air between the transducer and the probe cover, just like the gel serves without the gel. The probe cover can be easily repositioned on the probe foot. Typically, you'll smooth it out with your thumb to make sure there's no air bubbles or wrinkles that's going to impact that ultrasound image. The Envision cover comes with these really robust saline wipes to hydrate the patient's skin. You can use it also on the outside of the cover, and this will activate the hydrophilic coating on the cover, which means that you're going to get the optimal image quality without using the gel. Depending on how long you're scanning, you may need to rehydrate with the saline pad, or you can just take a little saline that comes in the kit and squirt it right on your site. And when you're cleaning your ultrasound probe, the equipment turnover is really speedy with the Envision because you don't have all that gel and that sticky residue that's left behind on the transducer. This probe is immediately ready for reprocessing depending on what your department protocol is.